had a number of miscarriages, and after each one we did tissue samples, and I always wondered what happened to them.
Pathologists are physicians who are trained in interpreting laboratory data, whether it's clinical data from blood samples and also for making diagnoses from tissue specimens and interpreting results from genetic testing. The most common tissue pathology tests are usually biopsies. It's usually put in some liquid like formalin, which preserves the tissue. We embed it in paraffin wax, and then actually the highly specialized technicians and technologists cut the tissue into ultra-thin sections, and they put it on a glass slide. And then eventually the tissue is stained with different colors, and that goes to the pathologist, and then he or she looks at that slide after it's gone through all this processing. And then, based on that, they can decide perhaps what the disease is or what follow-up testing is required on that piece of tissue. Why don't we get a higher power on that? About 14 or 15% of all our pathology cases are reviewed in a conference just to make sure, just as a quality control check. So we make sure that the results that we're giving out to patients make sense, and if a clinician has a question, we'll have a group of pathologists look to make sure we have a good consensus on what the diagnosis is. So there's a lot of checking to make sure that any result that comes out is accurate.
I think that you have to play a role in your healthcare, and you have to be your own advocate, and you have to ask as many questions until you feel that you have all the answers to make the right informed decision. So you really do need to partner with your doctor and as many of the team members as you possibly can to really get the answers that you need.
Pathologists are generally available to speak to patients. Oftentimes, the clinician is in a better position to discuss with the patient the totality of their care in terms of what does the result mean, what are the next steps, because their clinician is really the physician who's going to help direct that care. But we could certainly discuss with the patient what the report means and what the next diagnostic test might be.